Hi, everyone. I'm Dr. Alyssa Watson.
And I'm Dr. Beth Molleson.
Thank you so much for joining us again in the Veterinary Breakroom. In the break room, Dr. Beth and I have short conversations where we chat informally about relevant topics in veterinary medicine. And today we're going to be talking about something that both Dr. Beth and I have experienced, and that is practicing while pregnant and breastfeeding. And while we know that this is something that not all of our listeners obviously have experienced, it's certainly something that you've probably at least encountered if one of your colleagues was pregnant or breastfeeding. And so we thought this would be a way that we could share some of our own experiences and maybe vent a little bit about some of the things that have occurred in our careers, as well as hopefully give people some keys and pearls on how to support your colleagues that might be going through this, because it's a journey and it's not always easy.
I agree, Alyssa, and I'm excited to get into this with you because just chatting beforehand, I feel like we've maybe had some different experiences with this, and you have 2 kids. Let's start. Tell us how old your kids are so we can get a grasp of how long ago this was.
Yeah, so the time flies so much. I swear I'm going to just blink and my oldest is going to be graduated. But I have a sophomore in high school, and so he is 15. And then my youngest is 8, and he is a 4th grader right now. And you also have 2 kids. So Beth, how about your kids? How old are they?
I do. Yes, my daughter is 5, and then my son is 2.5. So he's my pandemic baby, which will factor into maybe some of my outlooks here. But yeah, so go ahead, Alyssa. I know when we first started talking about this, we talked about it from that outlook of, first things change when you're pregnant, not to mention just becoming a parent and then being a practicing veterinarian, but specifically while you're pregnant and of course have to show up to this very physical job. So I want to hear from you, kind of what were your initial experiences during pregnancy?
Yeah. So, my first pregnancy, my son was born, in 2008. And so it was, I was at a small practice. We had four other veterinarians besides myself. So not a big corporate practice. And I think a lot of that can affect how these different experiences go through, because there are some federal laws that govern, and we can talk a little bit about this, especially when it comes to accommodations that need to be made for breastfeeding mothers or for women who are pregnant in the practice. But a lot of those laws only apply to larger companies that have over 50 employees. And so I know that you've worked for a large corporation for your whole career. And so I was interested to see how your experiences might vary from what I had experienced. But I was a small practice. And at the same time I got pregnant, another one of the associates got pregnant 2 months after I did. And we were so excited because we were very close, and having that support from her, and she and I were both having our first child, and going through that with her was just invaluable to me. I will always treasure having that, but I know that it made things very difficult for the practice because we were both pregnant at the same time. We both ended up going on, maternity leave within 5 or 6 weeks of each other. And so I understand that was really stressful on the practice, but at the same time, we had some pretty negative interactions surrounding that. And I was even told at one time that the boss, in a side meeting that I was not privy to, said that he would never ever hire a woman of childbearing age ever again.
No. That is, yes, that is, yeah, that's horrifying. I mean, it's hard to come back from that, knowing that that's the kind of environment you're working in. I can't imagine trying to ask for any accommodations or discussing maternity leave. I feel like that really puts a cloud over everything. And I must admit that it sounds like we were probably in very different environments. I have worked at a corporate practice my whole career. I'm trying to think if I've ever worked with, I don't think I've ever worked with a full-time male veterinarian. So it's always been kind of a homogenous group of women of childbearing age, of course, many others of whom had already had kids, which was just fantastic because when you're, I mean, there's nothing better than like your boss having gone through the same thing a few years prior. So I feel like I was very fortunate in that scenario where, you know, I wasn't like the first employee to have had a child. There were, you know, of course, kind of an outline in place on what maternity leave looked like, limitations around the hospital. I feel like my, you know, associates were all will, you know, like just the helping to restrain pets or helping to pick up pets or things like that. It was very just a supportive environment, which I was grateful for. But yeah, not everyone gets to experience that. And I will say, I also had very easy pregnancy with my first. And I do remember many times thinking, like, I literally don't know how people do this job if you're dealing with severe, you know, morning sickness or severe nausea. I shouldn't call it morning
Mm-hmm.
sickness, just the severe nausea or like
Because it's all day.
sciatica or, yeah, exactly. I mean, I had mild enough, but I was able to deal with that. So, yeah, just in just how physical of a job this is. So, yeah, I feel like I was very lucky in both of those aspects where physically my pregnancy, I was able to keep doing a fairly physical job, fairly high paced job. And then support wise, had a lot of colleagues who had experienced the same thing, were willing to kind of pick up in places where I couldn't. But yeah, how did you feel physically? Like, did you have to have a lot of physical limitations during pregnancy?
So, as just like you, I feel very lucky that, you know, both of my pregnancies were fairly smooth. My first one, I did have my first child was a little premature. He was almost 6 weeks early and breached, and there was a whole emergency cesarean that happened, and I practiced with both of them, you know, right up until delivery,
Mm-hmm.
basically. And so I do kind of wonder if I had maybe slowed down a little bit with my first, if I might have avoided that situation, but you never know. I mean, who
Right.
knows? I definitely did not ask for a lot of modifications in
Mm-hmm.
my duties or my schedule. And looking back, I wish that I would have. I wish that I would have sat down and said, you know, I mean, obviously, I tried to stay out of radiology as much as
Mm-hmm.
possible. Did you change your schedule like that at all? Or did you have any specialized PPE or get like a fetal dosimetry badge or anything
Yes, I
like
do
that?
remember getting the fetal dosimetry badge. And I do feel like you bring up a really good point because, you know, when I talk about my pregnancy experience while working being pretty smooth, I should say there was still an undertone of like, I'm mostly grateful that I didn't have to ask for any accommodations. I still feel like there's that tone of like, there's that guilt that comes along with it of like, oh God, like I don't want to have it. Thank God I don't have to ask for schedule changes. Thank God I don't have to
Mhm.
ask for too many accommodations. Like I don't want to be the one that has all these special needs. And, you know, part of that is a little bit of a disservice because there are plenty of people out there that may need those accommodations. And so I do, you know, even when I have had other, and this is something I've experienced where I've had other colleagues where a pregnant employee has come after me has maybe needed certain accommodations, and I've had other employees come to me and be like, well, you didn't need that while you were pregnant, you know, do they really need that sort of a thing? And so I feel like that's an interesting aspect of like, you know, just because I didn't have to ask for schedule changes or a lot of limitations, like I feel like, you know, people can really have that guilt associated with needing those special accommodations. So it's just, yeah, the mom guilt starts early, I guess, is my point.
It
I don't
does.
know.
And we need to, just like you said, remind ourselves not to compare,
Mhm.
you know, our experience or what we've seen another colleague with what a particular person is going through, because everybody's pregnancy is different. Everybody's health is different. Everybody, you know, and there may be some things that a person doesn't want to share, and, you know,
Right,
that's okay. Um,
right.
so, so yeah, so I worked, I did surgery. I didn't wear a respirator or anything like that, although definitely I've had staff members, you know, licensed technicians and things that do wear those. And I think they're, you know, I think it's wonderful that we have that option out there for people, you know, to be safer. I kind of wish that
Mhm.
I had been a little safer.
Sure. I feel like I'm the same with you. I remember relying on my doctor a lot. I feel like I always felt like, well, my doctor will let me know if there are certain accommodations I need to make or things like that. But then I almost feel like, our OBGYNs well equipped to know all of the risks, all of the workplace risks for every profession out there? Probably
Sure.
not. So,
Right.
that's always
Exactly.
another concern is, are there, I remember finding out like in my 8th month of pregnancy that one of the cleaners we used was like recommended to avoid if you were pregnant. I'm like, oh, didn't
Hmm.
know that. So and
Oops.
what I remember also being terrified of being like getting a dog bite, just, knowing my immune
Hmm.
system was down. And it can feel like it can be a scary profession with lots of exposure. And not to mention now that that transitions me into my next child, which I got pregnant right at the beginning of the pandemic. And so that was a scary time because I mean, we all know now, we didn't really understand then, but that pregnant women, especially unvaccinated, which we all were at that time, were at such a higher risk for morbidity and mortality associated with COVID during pregnancy than those that aren't pregnant, of course. And so I did actually wound up taking some time off during COVID. So I did not
Hmm.
practice a lot when I was pregnant with him. My mom was our main caretaker, and she is getting close to 80. So I didn't want to risk, me being with the general public all day, and then having her come in the mix of our family, as well as me being around the general public, just being pregnant for my own health and safety. So anyway, just minimal accommodations with my first pregnancy. Second pregnancy, I pretty much altogether took a sabbatical, which I don't even need to go into how fortunate I was to be able to make that decision. But yeah, that's how, during that period of COVID, that's how many special accommodations I needed. Was I decided it just was too risky to even be working. So
Yeah. Yeah. I both of my children were born by the time the pandemic arrived, but I've similarly just not anything to do with being pregnant, but my youngest son had a year or two before COVID had Kawasaki disease,
hmm
which is an immune mediated arteritis, and it's very kind of similar to that Miss C that the kids were getting.
Yes.
And so yeah, so I was petrified. I would come home and strip in
Yes.
the garage and take a shower before I would touch anybody or anything. So
Mm-hmm.
I definitely understand where that
Stress.
fear comes in and the stress. Absolutely.
I know, it's almost
One
funny to
thing
think about
that
now, like, oh crap, sorry, Alyssa, I must be on a
Go
delay.
ahead.
I'll pause. It's
Pause and
almost
then you
funny
go.
to,
Okay.
yeah, okay, sounds good. It's almost funny to think about now. I mean, it almost seems crazy to remember those feelings of panic in the early days of the pandemic. But anyway, this is making me go down memory lane, remembering all of the unknowns and how scary it was. So glad we have those vaccines
Yeah.
on board now.
Yeah, it was. It was. So
Um,
one thing that I think sometimes people talk about and people do, and I was curious if you did it. Did you have access to an ultrasound? Like, did you ultrasound yourself, your own fetus?
I didn't have access, but you better believe I probably would have. What about you?
So I didn't with my first. I didn't have
Okay.
access with my first, but at my second practice with my second pregnancy, I did have access to an ultrasound, and I think I did it maybe once or twice during my pregnancy. But with both of my kids, I didn't want to know the gender, and so I was
Mm.
like petrified that I would pop the probe on and
Hmm.
and they'd be sitting there just spread eagle, and then I'd know and I'd be upset. So I
Yeah,
didn't I
smart
didn't
move.
ultrasound myself a lot.
Yes, a smart move. But so I want to hear more about obviously it sounds like the scene was set where there was a contentious relationship with your boss during your initial pregnancy. So how did that translate into maternity leave? Like what did your maternity leave look like in your return to work? And Lord knows the pumping and the breastfeeding and all that. Did things get better then, or is that the time period that made him make those statements?
so so with the first, like I said, very unexpected. I went into preterm labor, and I didn't even know that I was really in labor. I was having a lower back labor, and
Uh-oh.
I thought that, I had done a really long surgery. I'd had a dog that like ate half of his dog crate, and I
Oh
remember just having
God.
this horrific surgery where I got in there and the duodenum had perfed and I was way over my head, and I was on the phone with our specialist, our surgeon in
Mm.
town. I was practicing up in Reno. This is before I came down to Las Vegas, and he walked me through how to do a serosal patch.
Oh my
And
gosh.
yep, and I put in a feeding tube and woke the dog up and sent it. And so I was really like, so the next day I was off, and I had a lot of lower back pain, and I thought it was this long stressful surgery, but really I guess that was apparently labor, because then I drove myself to the hospital 10 centimeters dilated, and I had a
Oh my
baby like 2
gosh.
hours later.
Oh my God. I've never heard that story, Alyssa.
Yep, yep,
That's wild.
yeah.
I mean,
So
too bad you didn't come one day earlier. You could have avoided that surgery.
that would have been good, right? um so then I was off. I took for my first, so for both of my maternity leaves, I did not have paid maternity leave, which is something that I think that we could certainly have a huge discussion all about paid maternity leave in the US, as opposed to other countries. I know we have a wonderful global audience, and I know that this is very foreign to a lot of people,
Hmm.
to not have some sort of paid maternity leave. But with my first baby, I took 8 weeks off, which again, way too short. I wish that I could
Hmm.
have taken much longer, but financially, that was all we could do
Sure.
at the time. Um, I had, with both of my practices, I had worked out a little agreement on pay. These are things that I never would have thought of going into this career. It never even occurred to me that these were things that were going to need to be worked
Right.
out. And one of them was I was going on unpaid maternity leave for 8 weeks, but my practice, there was a portion of my check that went to cover my health insurance and things like that. And so when I went on that leave, I was going to have to pay the practice back for that.
Oh my gosh.
And so, in order to circumvent that, I had made kind of an arrangement with both of my practices that I started kind of like a maternity stash or fund, where
Oh my
they
gosh.
underpaid me all during my pregnancy and kind of set that money aside so that then I wouldn't have to pay the practice back for those things that came out of my check, health insurance and things like that.
Oh my
So
gosh.
yeah, so that was something that I was going to ask you about. What was
Yeah, my
your
God. I was gonna
maternity
say, I
leave
hope our
policy?
foreign audience is plugging their ears because that's depressing. Mine, so I was a little bit of a unique situation where I was on my husband's insurance. So I was privileged in that regard to not have to deal with any of that, nonsense that comes with the leave and everything. And the downside was I think I was working 30, I happened to be working 30 hours at the time for various reasons. And I think full time was 32 hours. So I missed out on any short-term disability or of course any maternity leave. At that time my company did not have official maternity leave. It was just a short-term disability, but I'm happy to say that has since changed. So yeah, benefit was I didn't have to deal with any of that nonsense. Downside was of course then um, it was unpaid leave for me completely. And I think I wound up taking about 12 weeks, um, which I have to say, my first child has really challenged me in the toddler years. So she has made up for it. So I can brag about this now. But she was a very easy baby and like slept through the night very early on. And I actually remember feeling ready to be back at work at 12 weeks. But I know that's not the case for everyone. So again, I was very lucky in that regard. But yeah, I don't, you just feel like 12 weeks should be the minimum. I mean, that's like, until then, I mean, you barely have a handle on on
Mhm.
anything, on what's up,
Yep.
what's down. getting a baby to take a bottle or feed it, eat it all for
Mhm.
that matter, I feel like is still a challenge for some people. I mean, not to mention like childcare. Again, we don't need to go into all that, but like sending a naive little immune system into a daycare environment at less than 12 weeks. I mean, yeah, it's just overwhelming to think about.
Yeah, and going back at 8 weeks with my first, I mean, I was barely out of bed and moving around
Mm-hmm.
because I had, that emergency C-section. And actually, then I had an elective C-section with my second child. But that's, something too it was definitely hard. I wish that I could have
Mm-hmm.
taken more time. And so that's one place where to just again realize everybody's experiences are different, and so some people
Mm-hmm.
have a really easy pregnancy or a really easy birth and others do not, and so just to be cognizant of what other people are going through, and
Right.
just having people say, hey, like, it's so good to see you back, and we know it's hard. That, to
Mm-hmm.
me, those interactions were so meaningful, and so
Right.
helpful, and so just to put
And
that
I
out
think
there for
asking
everybody.
about, yeah, physical limitations too. I think people expect that by the time you're back
Mhm.
at work, you're back to normal. And I mean, I had two C-sections as well. And I still remember, like, again, I didn't go back till 12 weeks, but leaning against the exam table and just that like searing
Mhm.
pain along my abdominal incision, if that tells you anything. So, yeah, I do think you're right. Small comments or questions about what you can do to support someone that's freshly back from maternity leave goes a long way. And dare I ask, Alyssa, that especially at your first practice, what was your experience with like pumping or breastfeeding or any of that
Mhm.
stuff? Like, were you given adequate support there?
So I did choose to breastfeed both of my children, and so I did have at both practices. I asked for pump time, which I was given, thank goodness. Um, Not always respected. So there were, it took a lot of time with the staff to really
Mm-hmm.
get them to understand that I needed time to kind of decompress and not to be doing notes or being interrupted. Both of my practices, unfortunately, did not have a really good dedicated area in order to pump
Mm-hmm.
in. And it wasn't just a problem for myself, but for, other associates as well as other staff members that I've worked with that have been pregnant, over the years that I've practiced. And I think that is someplace where we really need to step up. Everybody needs to step up and say, we've got to have a place for mothers, because mothers are in the workforce, regardless of what role they're serving in the practice. Mothers are in the workforce, and we have got to have a place where they feel like they can pump and get a little break to do that, because it's not as easy as throwing the pump on and going
Right.
and doing, other stuff. I really needed to sit. I needed to relax. I needed to look at a picture of my baby. Um, in my first practice, they had the only place for us that wasn't a bathroom was the kennel. So they actually
I
like
can't
put
help
up
but laugh, Alyssa. What
blankets
does that
on the
mean?
last
Is
dog
this like a
run.
full
No,
run?
like it was a dog
Or
run. Like it was a
like, did
full
you have to
run. Yeah, it
crouch
was a
down? Okay.
no, it was a full run. So it was a
Oh
full run with
God.
6 foot walls that, but
Oh
chain link
no.
fence. It was a dog run that we
Oh
hung
my
blankets
gosh.
on. And looking back, I'm just thinking, oh my gosh, I cannot believe that I did this. And I did it,
Right.
because it was important and it was important to me. But I think that it could have been handled differently.
Yeah, yeah. And it is. It's interesting. And again, I do feel like I breastfed my first for I don't even remember how long, several months. This is all, and I hated it. This is also my PSA to tell anyone out there that you don't have to breastfeed your kid if you don't want to. With my second,
Yeah.
I went straight to formula feeding and it was phenomenal. Um but yeah, there's a balance between the fact that especially in the veterinary field, there are so many women in the workforce, and this truly is a necessity. And then, of course, having a little bit of like sympathy for the fact that so many vet hospitals are in these cramped spaces, and it is a challenge. But I do think it is like you said, it's something that's important and required and necessary if we want to keep women of childbearing age in the workforce. So yeah, I'm sorry about the kennel situation. That sounds slightly demoralizing. But yeah, paving and again, I was lucky in that regard too, where fortunately some moms had come before me and had paved the way in that regard. And we had a pretty good setup, but yeah, I know not everyone's that lucky, and it's hard in these small, any small business, veterinary clinics too. It can be challenging and require a little bit of, chutzpah from all of us moms out there to make sure we have the accommodations we need.
Yep. And I think, this is a fair time to say too, that it's not just the veterinary profession, so I don't want people to feel like we're picking on veterinarians or veterinary clinics or this profession. Certainly the CDC's website, here in the US says that they surveyed people, recently in the last couple of years, and only 40% of mothers said that they were given breaks and a private, space to pump, even though that really is required by most, federal law for most employers, as long as you have, over 50 employees. So we're not the only ones.
Yeah, you said so. Exactly. It is. It's a nationwide issue and a federal issue and a cultural issue. I feel like not that long ago, there really just weren't that many women in the workforce. So I feel like in some ways we're one of the first generations coming through where the majority of moms are working, and it requires a little bit of groundbreaking, for better or worse.
So I'm glad we got to be part of that groundbreaking, so everything changes, professions move forward. I think that we can definitely get this handled and solved. And thank you for letting me vent a little bit about my experiences. I don't want everybody to think it was all awful. I loved my practices. I loved my clients. I had wonderful clients that were so excited about my pregnancies and following through and brought me things when I got back. And so not to say like everything's doom and gloom and it was awful. It really wasn't.
Yeah, and I bet, moms that work at that practice now, I like to think, are having an easier time with it now. So, it does take a little bit of that paving the way. But anyway, Alyssa, I think that brings us to our win of the week, dare I say. Do you have any wins this week?
Well, given today's topic, I feel like my win should be that the kids went back to school. And so we're back in school, and everything went fine. Everybody got there the first day, got home. We've made carpool schedules and all of that. So I feel like all of that beginning of the year stuff is a whirlwind, and we made it through, and now we're kind of settling into the groove.
That is a huge win. Mine is actually very similar in that, since this is a momish episode, that my firstborn starts kindergarten tomorrow. So it's a momentous day in the household. She had a few mornings of like kindergarten jumpstart, they call it, last week, where she went and met her teacher and hung out for a few hours. Although now I think it's backfiring a little bit, and I think she expects school to only be like 3 hours. So I do
3 hours
when tomorrow it's 8 hours. And then she's also signed up, speaking of working moms, she's signed up for the aftercare program. So she's going to be there a long time tomorrow. So please wish me luck that her mood is okay when she gets home. But regardless, I'm excited. We're going to do the photo op of the smiling kid in the morning. If I can pull that off, it'll be a success. So
it'll be great. I'll be looking for it. Well, thank you everyone so much for joining us. We hope you enjoyed this episode of The Break Room, and we'll see you next time.
Bye, everyone.
Thanks for listening to today's episode of The Veterinary Break Room. If you enjoyed this episode, you can find us wherever you listen to your favorite podcasts, including a video version on YouTube. While you're there, make sure you subscribe, rate, and review us. You can also listen to or watch our podcast episodes on our website at cliniciansbrief.com/podcasts. Drop us a line at podcasts@briefmedia.com. Veterinary Break Room is a Vetmedics production, produced by Alexis Ussery and co-hosted by Dr. Alyssa Watson and Dr. Beth Molleson.